I'm Peter Apel. I'm the senior author on the study, and I'm from Virginia Tech Carolina.
And I'm Cesar Bravo, one of the co-authors of the study, also from Virginia Tech Carolina Clinic.
What led you to do this research?
We remember we were at the ASSH meeting in Boston, and we were talking about using therapy after CMC arthroplasty. And we talked about how a lot of folks don't use therapy at all. And then we did our survey, the ASSH survey, and we found that over 80% of surgeons are prescribing some sort of therapy, but less than 3% are using any sort of patient-directed method.
Yeah, I mean, it was incredible because we were talking about this pre-pandemic.
That's right.
And just the importance and the usage of telehealth and how could this impact our practices. And then the pandemic hit, and it really made us, aware and kind of realize that this is a powerful tool that we may need to use for our patients.
Yeah, and then we first started the study. We were originally going to use, remember we were going to use interactive. Mm-hmm. And we were trying to do that, and then the pandemic hit, and the technology group was just overwhelmed with having to use telehealth, and basically were unable to help us get this set up for patients. And that's when we then redesigned the study to do video only.
Yeah, it just that skyrocketed from there, and now this has led for us to use video only in a lot of parts in our practice, orthopedic practice in general.
Yeah, we're trying to examine other places where it's easier for patients to get their education via videos and then essentially do their own home care rather than have to come into the office for postoperative care for therapy. So this study has really, for us, started a whole line of research.
Yeah.
What findings surprised you?
I think one of the findings, Peter, that really was remarkable was that we had to kind of stop that, the study as we were going midway through it.
Yeah, we had originally planned, our original power analysis was for over 100 participants, and we did a midpoint analysis and saw that non-inferiority had been met. And we stopped the study early.
Yeah, I mean, that was right at 58 patients.
Yeah, right about halfway through.
Should practitioners change their practice based on your findings? And if so, how?
Even before our study, we knew that the use of therapy, supervised therapy after CMC arthroplasty was controversial. Yet a lot of surgeons were still doing it. We think that this represents a nice step down from doing nothing to having a patient come in for 10 or more supervised visits. So we think that providing the education and letting the patients do it on their own is a great intermediate way to reduce the burden of care for patients. So we think that this is something that hand surgeons should implement.